one
First.
is normative value of AC versus A ratio, and it's presented by Dr. John Kennedy.
Are you the chief author? Sorry?
No, ma'am.
Okay, you're just presenting.
So please just
Start.
tell us your name, please. Then.
Shiny, sir. It's my
Shiny.
second name. They have
Okay.
written.
All right. Thank you.
Sanidhi.
Shiny, shiny.
Shiny is not
Normative
here.
Name is
value
not-
of
My second name is there. Shiny JK. They have written John Kennedy as well.
Okay.
okay.
But here's Sanidhi. Okay. Yes.
That's my name, but they have written.
Okay. So do we write present because the main speaker is not present now? Go ahead, please. Start.
Good morning. I'll be talking about normative value of accommodative convergence accommodation in Indian population measured by heterophilia method. So near response is a complex neuromuscular process which the main aim is to maintain binocular fixation and clear retinal images despite change in fixation. It composes of accommodation, convergence and meiosis. So synkinesis of these movements are necessary to maintain a good binocular single vision, thereby stereopsis. So AC by A, that is accommodative convergence per diopter of accommodation, is a vital parameter which determines coordination between these movements. AC by A ratio helps in determining the ocular motility disorder and to manage cases with abnormal AC by A ratio. So AC by A ratio is determined by following methods, gradient and heterophoria method. Gradient method, which is more of a theoretical method, which measures the amount of convergence generated by diopter of accommodative effort. Heterophoria method, which is more of a clinical method, which determines the presence of distant near disparity in prism diopters. Heterophoria method has convergence as a component and it measures intrapupillary distance. So it varies in various races and ethnicity. So it has more clinical relevance. So our study is a cross-sectional study. The aim is to determine accommodate AC by A ratio in Indian population by heterophoria method, which is measured in a normal asymptomatic adults. The place of study was in a tertiary hospital in Western Andhra Pradesh. We selected 100 eyes, the 100 eyes of patients who were attendants of patients visiting the hospital, healthy eyes with no refractive error or no eye pathology. And the age group selected was 19 to 50 years. They all underwent baseline ocular investigation in the form of refraction, a slit lamp evaluation, and cover-uncover test to test for both distance and near, and fundus examination. The foria for distance and near, which was determined by prism bar, fixation target of 6 by 9 is fixed. And the IPD is measured by a horizontal ruler with the first Purkinje image as reference. And AC by A ratio is calculated using the formula. And IPD in centimeter, the N is the near deviation, and D is distant deviation, and D is the working distance in diopters. So our result showed mean intrapupillary distance of distance is 62.88 millimeter, and the average foria measured for distance was 1.82 and near was 4.20 prism diopters, and AC by A ratio was 5.49 prism diopters. And the previous studies showed which was gradient method, which was generally done, and the gradient method, and this showed there is variation. The heterophoric method is relatively lesser. The values derived is relatively lesser. And previous studies which were conducted by heterophoric method, which were again differing than our study, because it was higher, because the race and the ethnicity difference was noted. Ours is Indian and the previous study was of Australia and UK. So to conclude, the normal range of AC by A ratio by heterophoria method in our study population was 4.41, which was correlating with the normal average AC by A ratio, which was 5.49. Thank you.
What is original about your study?
Ma'am, the last study which was conducted, which was by heterophoria method, which was in 1972, not in southern population. So we wanted to determine AC by A ratio by heterophoric method in southern population, which was not done. And there it is because IPD and it has IPD and convergence as its component. So it varies for race and for different population. So that's why we wanted to.
Okay. For the benefit of the audience, can you just tell what is the difference between the heterophoria method and the gradient method of measuring AC by A ratio?
In heterophoria method, we measure with the help of IPD. IPD is a component of, IPD is intrapupillary distance, which is a component of heterophoria method. So, for example, if you take Indian population, the eyes are smaller than the general Western population. So the convergence required will be lesser for Indian population compared to other population. But gradient method, which is a theoretical method, which doesn't have IPD measurement or convergence as its component.
What does it use? What does the gradient method use?
Gradient
Do
method.
you know about the grade? So if you are studying a comparison, see, there are two methods.
Yes, ma'am.
So you need to know the other method as well if you are using one. So do you know about the gradient method?
Gradient method has its formula,
So tell us.
which
Okay.
Okay,
which
it's all right. You don't know. It's okay. Fine. Thank you.
thank you.
Think I've got it.